Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is avoiding surgery for degenerative disc disease. Here's a shot of the normal intervertebral disc. There are two layers to it. The outer layer is called the annulus fibrosus, and this has nerve endings and can feel pain. The inner jelly layer is called the nucleus pulposus, and it has no nerve endings at all. Okay? Normally all of this is 80% water and 20% collagens and protein. The jelly donut is the best analogy, where you have a soft inner part and then a little bit of a harder outer rim. Okay? And normally the disc is an excellent shock absorber. Every time we bend, twist, flex, extend, it shoots water out to absorb the stress and then sucks it back in. As we age, our discs start to turn into prunes. They start to lose water, and subsequently they can lose height. So here's a cartoon where you have excellent healthy disc here with height, and he's starting to lose some disc water, okay? So it's almost like a tire that's getting flat. And then here you really can't even see that there ever was a disc, okay? 40% of the time, the intervertebral disc is the cause of low back pain. And this may lead to inflammation and irritation of adjacent nerve roots, and that can cause sciatica, even if you don't have a frank disc herniation, okay? Now this can lead to daily disabling pain, or it may be completely asymptomatic. Okay, they've done studies with patients between the ages of 20 and 50 who have evidence on MRI of degenerative disc disease, and those patients were completely asymptomatic. Okay, so 35% of the time it shows up like this on an MRI, and they didn't have any back pain at all. So just because it's there doesn't mean it's going to hurt. What are the treatment options if it does hurt? Well, medications may include over-the-counter anti-inflammatories or Tylenol, short-term narcotics for exacerbation periods, topical prescription pain creams or patches may be very helpful, muscle relaxers can be helpful. Physical therapy has been shown to be great for degenerative disc disease. Chiropractic treatment as well, TENS units, which are about the size of an iPod, little foam pads that go on the skin. Slight electrical impulses go through, that can help with relief. What you see here, spinal decompression therapy, which is computerized intermittent traction through the back, that can help. Acupuncture has a lot of research behind it for low back pain. There are quite a few interventional treatment options available to help with non-operative treatment for degenerative disc disease, one of which is trigger point injections. These are simple, superficial injections that can help dramatically decrease spasms and aching. Intradiscal injections, such as you see here, is where medicine is injected into the disc itself that's degenerative. This may include just steroid injections, which have been shown to provide months of relief, or it may include some of the new regenerative medicine treatments, which may be PRP therapy or stem cell treatments. Facet treatments, these are treatments around the joints of the back of the spine. You might sit there and say, well, how come you're doing a facet treatment when it's actually a disc problem? Well, most of the time they go hand in hand. So if you can relieve some of the pain from the facet joints, it can help decrease the back pain overall. A medial branch block is when you inject numbing and possibly steroid around those joints, and that can stop the little sensory nerve endings called the medial branches from transmitting pain. A facet injection is when the needle actually goes into the facet joint and steroid and numbing medicine is injected. Those have been great for months of pain relief at a time. Radiofrequency ablation can be a great treatment where you have a catheter that goes in around those facet joints. Thermal energy is applied, and it can deaden pain for up to 1.5 to 2 years and give consistent pain relief. Epidural injections can be indicated if there's irritation of the nerve roots around the degenerative disc. This happens frequently. IDAT is really not done much anymore. It stands for intradiscal electrothermal treatment. There was all this hoopla about it years ago, but then subsequent research showed it didn't work very well, so insurance companies stopped paying for it. MILD stands for minimally invasive lumbar decompression, and this is some insurance companies still reimburse for it, some don't. But basically it works well. The pain doctor will go in with a minimally invasive device, decompress the degenerative disc a bit, and that can relieve pain, especially if there's a large disc bulge. Here's a radiofrequency ablation. You can see where the catheter goes in around the area of the joint, okay? and it heats up these nerve endings and basically deadens them for a long period of time. For the stem cell injections, there are several different methods of doing that, one of which is shown here, where you take bone marrow from a patient's iliac crest, and that goes into a centrifuge machine, which helps concentrate the stem cells, and then these are injected into the disc space. And these are what stem cells look like. They're kind of like blank slate. They can turn into, collagen or other types of cells. Comparison of long-term outcomes for patients with back pain who had a positive discogram did not demonstrate a significant difference in a lot of outcome measures between whether they had operation or not. So most patients can have a successful outcome for degenerative disc disease without surgery. 3/4 of the time, patients are able to achieve a satisfactory level of baseline pain without undergoing the knife. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.